My advice to docs who are still in that employed stage, but know that their plan is to transition into their own practice, really is to get the financial part squared away. If you're going to be insurance-based, to go ahead and start that credentialing process. It's never too early to start the paperwork and figuring out what you want those new patient forms to look like, what you want clinic policies to look like. And then again, go ahead and start thinking about marketing, because the marketing is so important.
Welcome to the Physicians and Properties Podcast, the show where we teach you how investing in real estate can give you the freedom to practice medicine and live life how you want.
Doctor! 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 Doctor!
Now, here's your host, Dr. Alex Schlow.
Dr. Brittney Anderson, welcome to the Physicians and Properties Podcast. I am so glad that you're here today. We had a little bit of technical difficulties, but we made it happen. So really excited about that. I'm going to introduce you to the audience here real quick, and then we'll jump right into this episode, which is going to be awesome. So Dr. Brittney Anderson is a board-certified family medicine physician, founder and CEO of Anderson Family Care, which is a thriving private practice that she launched in 2022 in Alabama. She hosts the Physicians Hanging a Shingle podcast, where she helps other physicians step out of the traditional healthcare model and build practices that give them both time and financial freedom. And this super cool thing that she's doing as well is she's also investing in her community by helping revitalize historic downtown properties. You have a laundry list of accolades, and it's such an impressive resume. Board chair of the Alabama Academy of Family Physicians, vice speaker for the Medical Association of the state of Alabama, been on numerous boards. I am so glad to get to talk to you today on the podcast. How are you doing, Dr. Anderson?
I'm doing fine. It is so great to be here. We had a few technical difficulties getting on, but where there is a will, there is a way. And I'm so excited to be here with you. Thanks for having me.
Absolutely. It's my pleasure. I'm excited to have you here as well, and really excited to share your journey. Do you mind sharing your journey into medicine for folks here on listening?
Yeah, I would love to. So I grew up in rural Alabama. And as you said, my practice right now is in Alabama. I grew up on a family farm in Alabama. My parents have said that since I was 6 years old, I've been saying that I wanted to be a physician, which I found really interesting because, we'd go see our family doc. I was not a very sick child. My siblings weren't sick often. So we'd go for our checkups, right? And I never saw a doctor who looked like me. I loved our family physician, loved getting to see him and spend time with him when we went in for our visits. But I'm not sure where that desire came from to want to be a physician. So I have said that for a long time. Went to my undergrad college at Duke, loved Durham and that North Carolina area, and had the wonderful opportunity between my sophomore and junior year to do a study abroad program. So I did it in Ghana, West Africa, had a wonderful time, went there, was really engaging with the folks there, lived with the host family there. In day 12 into my trip, got super sick, high spiking temps, the nausea, vomiting, fever, all the things, and turned out I had malaria. I was living with the host family there, and I'll never forget, my host mom took me to a clinic there in the village that they lived, and there was a dad who brought in his young daughter, brought her in, carrying her. My host mom knew the family, and she talked to me about just how far they had to travel to get to the clinic where they were. And we talked about them at length. And I remember coming home from that trip and telling my parents that when I finish college, I'm going to medical school for sure. I'm determined at this point, but not just that I was going to go back to Ghana, West Africa to practice medicine because there was such a shortage of physicians there and so many people who needed me. And I remember my dad saying, "Brittney, look around. We are in rural Alabama. We are on a farm here in Alabama. You can look either way, north, east, west, or south, and there are people who need you as well." And so he told me it was a noble plan to want to go to Ghana, West Africa to practice medicine. Maybe there was some good that I could do here in Alabama first as well. And that really spurred my desire to want to be a physician. It went more from me just saying it to I invested everything I had into it. So finished out my undergrad studies there, came and did medical school in Alabama, did my residency in family medicine, in Alabama and Tuscaloosa as well. And I've been here since then and will be here until I leave to go to Ghana, West Africa to finish out my career.
That is amazing. I love Africa as well.
Yeah.
I got to spend 6 weeks in Zimbabwe working at a
wonderful.
rural hospital. It was amazing.
Yeah.
It was absolutely amazing. I loved it. I loved the people. I love the culture. And, Dr. Sherman, I just had him on the podcast.
Yes, I listened to that one.
Interviews. Oh, nice. Yeah, just came
good.
out. Yep. And we were talking about, international medicine and traveling. And I'll say the same thing I said there because I think it's just so relatable. Is just how they're so materialistically poor, but relationally rich. And here we're the opposite. We're so materialistic rich and such a wealthy country and relationally so poor. And it's just so interesting to see. And I think we can learn a lot from that and learn a lot from those experiences. And I remember you had mentioned, the dad bringing their child in and having walked a long way to get there. There were people that were walking for days just to get to the hospital. And then they would get there and we would be done seeing patients or it'd be nighttime and they would just sleep outside the doors of the clinic and just wait till the morning. And it's just wild, and you think about the access problems we have with healthcare in America and then compare that to Zimbabwe or compare that to Ghana. We're still so incredibly blessed. Certainly there are lots of things that can be done differently, but anyways, that's amazing that you got that experience. And I love what your dad said of like, hey, look, there's an incredible need here in Alabama as well. And that's awesome that you're getting to serve your state. And what a cool story.
Yeah, absolutely. That's it. And I had the great chance to go back years later when I was then a medical student back to Ghana and actually got to do a clinical rotation there. And to your point, and to the point that Dr. Sherman was making on your recent podcast episode, it absolutely changes your mindset about how you want to practice medicine, about what true needs are out there, and really pushes you to be the best physician you can be. But you're so right that there are so many access issues there comparatively there, but people are just so overwhelmingly grateful for the care that you give. And we try to find that in small pockets here in the US as well.
Yeah, absolutely. I remember they had their medical record that they had was basically like a composition notebook. And you just wrote right in that, you added your signature and that's where you wrote prescriptions. That's where you wrote orders. Like everything was written in this composition notebook and they carried that around and brought that everywhere. It was so fascinating. And then you see how, complicated some of our
EHRs can be. Exactly. You're so right.
Yeah. Maybe one day we'll flip and go all the way back to paper. Who knows? But no, technology has done a lot of amazing things, but those trips are incredible. And I'm glad that you got to do that. I can't wait to hear more about Ghana and more about that experience going forward. So what was it like coming back to Alabama, back to your town, getting started practicing medicine after you finished up your family medicine residency?
Yeah, so I actually took a little bit of a round trip to get here. So I did what most people do, Alex. So I went out of my residency training and went straight into employee practice. I think that so much of our residency training and just our medical training in general, it still leaves out that idea of doing independent practice, whether that is a traditional insurance-based practice, or now we see so much in the way of direct primary care, direct specialty care clinics. But I did what everyone in my class did. We're a large residency program. We're 16 family medicine residency. All 16 of us went into employee practice afterwards. And so I did that for a good little while, did it for 6 years total. First 2.5 years of those were at a federally qualified health center. So seeing, uninsured, underinsured patients. And it really was, it was wonderful work that we were doing, but it was tough work at times. There were times that I would go in and would, be me, my receptionist, and my nurse. Some days I wouldn't have a receptionist. Some days I wouldn't have a nurse. Some days I wouldn't have a receptionist or a nurse. And it made for a hard way to practice medicine. So lots of things happened. The hospital that we were affiliated with, like so many hospitals in our state and the rural parts of our state, ended up closing. And so then I was looking for somewhere. I still wanted to do rural medicine and knew that I could, always go home to the residency program that I trained at. So like many of us, I went into academic medicine, and that was a feat in itself. I loved being able to teach medical students and to teach residents, and at the same time have my own clinical panel patients. But academics is hard. It's a hard way to have a career. For me, at least it was. There were so many things that I saw in practice that I wanted to change to be better for myself, to be better for the staff around me, and to be better for the patients. But as is true in academics, you had to run things up the ladder, right? And there were often many people that you would have to ask questions to, sitting at committees, making proposals in order to change things. And I just got to thinking about my doc growing up and the docs that I shadowed, growing up in the town that I lived in, and remembering how they had their own practice. And I knew that they were able to make decisions that were, again, beneficial for them, their staff, and their patients, our community. And so the itch began, and I, went another 2.5 years and realized that itch was going to have to be scratched. And so there's where my plan for private practice began, and it has been a great ride since then.
That is awesome. So you launched in 2022, correct? Mm-hmm. Right after COVID disruptions and everything else. Is that correct? That must have been a unique time period for you. How did the timing, how did that affect your strategy? How did that affect the launch of your practice?
Right. So, I took it in stride. You're right. We were just coming, what the Dolphin was coming out of COVID and out of, maybe what we consider then the worst of COVID. And, COVID, as it did for many physicians, took a toll on me. Again, employee practice in general, I think, took a toll on me as well. And so I was at this period where I have to do something. I came into medicine loving the idea of practicing medicine, taking care of patients, and that joy was it was gone, right? And I know you've had Dr. Mary Long on the show before, and I love her. She talks so much about finding fulfillment and finding joy in medicine, and that was what I needed. There were times that I would pull up to work and literally have to sit in my car and give myself a pep talk before I got out of the car to then go in and see patients and try to take care of patients. And that's just it's not sustainable. And so despite being right on the tail end of COVID, I knew that something had to change. And it was either that I was going to change or the job was going to change. And the job was not going to change. So that meant that I needed to be the one to make a change. And so, buckled up, made the decision to start the private practice. I actually got I don't know if burned out was a word, but I had just such a bad week at one point that I booked a flight, a round trip to Honolulu, Hawaii, stayed for a week. And before I left Honolulu, I had written my letter of resignation. I had made my entire business plan, and I was ready to start this practice. So I came back, gave my notice. The day I gave my notice, I had another 3 months to finish out my notice. But every minute that I was not seeing patients in that employed practice, I was making plans for my own private practice. And so, really that determination that, again, something had to change and that something was going to have to be me really pushed me to do everything I could to make sure that we were successful from the beginning. And I marketed it like crazy. And we had a really wonderful launch. We opened to a full panel of patients, and we have been rocking and rolling since then.
That's amazing. Really cool. What a very fruitful trip to Honolulu, and I'm sure
absolutely.
Much needed to escape, but what a way to do it too, and then come back just ready to roll. Dr. Anderson, what were some things during those 3 months while you're still practicing, finishing out your time and working on the business? What were some things that you worked on, or what would you say to folks who are in a similar position where they're like, hey, I think I'm ready to start my private practice. I got 3 months left. How can I structure that? How can I build that as I go?
Right. And I love that discussion. I spend so much time talking with docs who are in the process of trying to launch their own practice and are right where you say that they have given their notice, but some are using that as idle time. And that should not be idle time. That certainly should be the time that you are starting to get things in order. There's so much that you can be doing in that time. You can go ahead and start the credentialing process, which is a long, hairy process sometimes for folks who are going to do an insurance-based practice. But that can be started early on in just the planning. So getting a good business plan in place, getting your funding secured, and then starting to develop a marketing plan, which is so important as well. I, during that time, started working on my content plan for the marketing, what my social media would look like, because it was just extra time that I had in the evenings. And I found that once I really started working on it, I would get to where, yes, I loved seeing patients that I was seeing through the day, but I knew something else was coming. So that would push me to get through my clinic day, to give that clinic day all that I had and really go home at night, me and my dog, and we would hammer out what this practice would look like. But my advice to docs who are still in that employed stage, but know that their plan is to transition into their own practice, really is to get the financial part squared away. If you're going to be insurance based, to go ahead and start that credentialing process. It's never too early to start the paperwork and figuring out what you want those new patient forms to look like, what you want clinic policies to look like. And then again, go ahead and start thinking about marketing, because the marketing is so important. It's one thing to hang a shingle. It's a whole other thing to hang a shingle and no patients walk through the door. So marketing is important.
Yeah, absolutely. Yeah. Incredibly important. I mean, every business, no matter what it is, comes down to leads and getting leads. And medical practice is no different than that. Well, that is really cool. So kind of what, if you don't mind sharing, what does the structure of Anderson Family Care look like maybe when you started, and what does that look like now as you've continued to grow?
Yeah, absolutely. So I started to practice. So me as a physician, a medical assistant, an LPN, and our front desk receptionist. So the four of us started it together. We see patients 5 days a week, 4.5 days actually. We do a half day on Friday. I'm family medicine. I tell folks at this point I will do anything but deliver a baby. But with that said, I live in rural Alabama, so I may or may not drive around with a OB delivery kit in the back of my car just in case it's needed. You never know what you'll see driving down the road. But I will do anything but deliver a baby for the most part at this point. And so really just practicing full family medicine there. My youngest patient in the last 2 weeks was a 4-day-old who came in. And my oldest patient in the last few months is a 104-year-old. So we literally are seeing the full gamut of medicine in the practice. We are an insurance-based practice, and that poses its own challenges, or can pose its own challenges at times. But we have really turned that into a plus for us. We live in an area where I don't know how receptive our patient population would be to like a direct pay, a cash pay practice. But so we've made insurance pay work for us. We work really hard to be efficient, and we are efficient. I see 25 to 28 patients in a day. And one of the things that I love is that, you can ask one of my patients whose room I may spend 10 to 12 minutes in, how long did Dr. Anderson sit down and talk to you? And they will tell you that I say 25, 30 minutes. Some will tell you longer than that. And that is because we have really worked on being efficient in our practice. I go and I sit down, we talk about whatever medical issues they have going on. Then we talk about everything else. We talk about their family. We talk about social things going on in town. And so we work really hard to be efficient, but also to establish really good rapport with our patients so that they know how we feel about them. We know what they feel about the clinic, and we make sure that the experience is beneficial for everybody. So 25 to 28 to some people sounds like a lot, but when you are efficient and you make your intentions to do right by everyone who comes in the door, that is what keeps our patients coming back. It's what keeps our staff there. And so I'm fortunate that 3 years into this practice, we just celebrated our 3-year practice anniversary. Every staff member who started with me, it's still there. And we've added a quality coordinator. We've added a dedicated phlebotomist to the clinic, and we've added an office manager. So we continue to grow. This past year in January, it's August as we record, in January, I added a physician assistant because we were still getting so many calls for people wanting to be new patients. And unfortunately, we're just at a space that I, as one person, could not see another patient. So brought in a physician assistant who's been great. She doesn't see her own panel of patients. It is a true collaborative practice. And so still my patients, but she'll see them for the same day visit or sometimes a continuity visit, but my patients always come back to me. And so they don't feel like I'm giving them away to someone else, but we continue to be busy. We're at a space where we have 4 to 6 patients on average call every day wanting to come into our practice. And so in November, I'm very excited that we will add another physician to the clinic, and that will allow me then to go from seeing patients 4 days a week to 3 days a week. And that is one of the beauties that my private practice has given me. It's really allowed me to have some autonomy and some freedom that I need to be able to do other things, like buy properties.
That's awesome. Wow. What a cool journey. Congrats on 3 years.
Thank you.
Congrats on all the growth. That is absolutely incredible. And, all that growth has happened in such a short time frame. So that's amazing to hear. You're really crushing it. 25 to 28 patients a day did give me a little bit of palpitations. What are some tips, tricks, or systems that you've learned that's helped with efficiency for you?
Yeah, so absolutely. So a couple things. So one, the way we start our day. So we start our day with a huddle. So both my PA and I, we review all our patients either the night before or we get there in the morning. We review all the patients. Our nurses review all the patients. Our quality coordinator, the office manager, the receptionist, everyone reviews the patients for the first couple minutes of the day. And then we have a huddle together. And in that huddle, we go through every patient we're going to see that day. Who needs labs? Who still needs their colonoscopy done? Who has a balance that they need to pay? Everything that we need to discuss about patients, we very efficiently go through them. And then we've started doing something that I love, and that has been so great, that we go around each of us and we say our work goal for that day, and we say our home goal for that day. So my work goal may be to walk out of here with all of my notes finished today. And my home goal is that I've got to get laundry done before I go to bed tonight. And everyone goes around, and we found that when we do that, it really helps for us to hold each other accountable. We'll go back into clinic the next day and it's, hey, Dr. Anderson, did you get your laundry done last night? Or even through the day as we're working, if someone said, my goal is to, get all of the referrals sent in, then everyone else is helping that person make sure that they reach their goals for the day. So the tone or the way that we start our day really sets us up to be efficient through the day. Other things that we've done that are really technology-based, as we talked about earlier, is that I use an AI scribe in practice, and that has revolutionized the way I practice medicine. It's been great for me because I can leave out of the room and my notes done. It's great that I'm not there, pecking on my computer while my patient's there in front of me. And it's great that the system that we use gives us a patient summary. So the patient leaves with a summary of their visit, and it's written in a way that they can understand. And one of the things that my staff has noticed is that really cuts down on the number of patients calling back, right? Calling back and saying, what did Dr. Anderson say about this medicine? What did she say she's going to do if my labs come back okay? Because they're taking that out of there in their hands with them. So that's made us really efficient. Other kind of tech-based things that we do that help us out is we use a system that is okay, HIPAA-wise, for us to communicate with each other through the clinic day. And so we all have pulled up on our screen, if we remember, like AOL Instant Messenger. It's kind of like that in my head, that they can send me a message and say, hey, Dr. Anderson, you've been in that room too long, get out of there. Or it can be, hey, I'm going to do a joint injection in this room. I don't have to get up and go leave and go tell my staff what I want to do. I can send them a message, they come in. So there's not a lot of back and forth, right? Having the phlebotomist on staff has really helped, so that's not taking away from my staff time. So just little things like that we found that really help us. And having my staff give input. We have a staff meeting every week. Every week, Wednesday, I buy lunch for the staff. We sit down and we hammer out the changes that we need to make. And the beauty of private practice, unlike a big system, is that we can decide at 12:30 on Wednesday that we're going to change something. And when we open the doors back at 1:00, that change is in place. And we're able to say, all right, that was a good idea or that was a bad idea. But that's the beauty of it being mine, that I can make that type of change.
That's
a long
awesome.
answer to your question, but lots of systems that you put in place.
Yeah, great answer. Yeah, I mean, you have to have systems. You have to have that to be that efficient. And I will foot stomp as well. The AI scribe is just the most amazing thing. It is so cool to have the ability to look the patient in the eye, to build that relationship in a way that you can't do when you're just looking at the computer screen. And yeah, it's amazing. I love it. And I think if anyone listening to this has not yet looked into some AI scribe, it's definitely worth your time. For sure. And you just gave me a great idea too. I'm wondering if at the bottom of the template for the one that I use, if I can add please put this into a patient summary at a 5th grade reading level, blah, 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 blah. And it would do that for me, which would be really, really cool, because that is a great tip to give them that tangible summary. I usually write a checkout form that I give them that has some information, but not as in depth. So that's really, really cool. I'm going to try and implement that tomorrow. I'm now practicing in a direct primary care clinic. And so we can do the same thing. We can change it tomorrow if we want to. which is really awesome. That is so cool. Well, it sounds like, and correct me if I'm wrong, it sounds like private practice for you has just brought back a lot of joy back into medicine, has brought back a lot of things that you maybe couldn't have done in the employed setting, and it's really been a game changer for you. Is that a pretty fair statement?
That is absolutely a fair statement. I have again found my joy back in medicine, and I think a lot of that joy again comes from me having autonomy, having the freedom, and just the flexibility that private practice allows me. So that is absolutely a fair statement.
That is awesome. We've hit on a lot of the pros, a lot of the really good things about private practice. What are some of the cons, or what are some things that you've noticed in coaching others to open their own private practice, some other things that may be some hurdles to jump through?
Yeah, so I think the biggest hurdle that we initially all face is that mindset change, right? That realization that you are the CEO of this practice, and I am personally responsible for putting food on my nurse's table for her children to eat, right? And that again is a pep talk that I often give myself, that I have to remember that I am the CEO of this practice and that I have to make decisions that are best for my patients, best for my staff, and best for me. And so that is a weight that if you cannot handle that weight, then private practice is not for you. But that is certainly a weight that we take on. One of the struggles that I see docs make as they're thinking about, do I stay employed or do I, take the leap to do private practice or independent practice? It's just that fear of what's there. And that same thought that we have in the back of our minds that no one has taught me how to do this, that, maybe we didn't get that training in a medical school or didn't get that training in residency. So there's that bit of the fear of the unknown. And what I tell folks is that as physicians, we have done so many things that if we'd looked at ourselves 5 years before, 10 years before, we would never have thought that we could do. Intubating patients, running codes, delivering babies. I mean, there are super specialists out there who are doing, amazing, incredible procedures on tiny humans, on old humans, and we are successful at what we're doing. And again, we look back and probably at some time we all thought, I cannot do this, but we did it. And so as physicians, I really think that we are well equipped to do hard things, and we've got a track record. We've done hard things before. And so, I tell folks, if you can run an inpatient service, which we've all had to do at some time during our training, then you can run a private practice. It just takes that willpower to do it, in that, that drive within that says, I want this autonomy, I want the flexibility, I want the freedom that comes with it.
Yeah, that is well said. There are so many incredible qualities that physicians have that make us incredible entrepreneurs. And you're exactly right. The first thing is just getting over that initial hurdle, getting over that quote unquote imposter syndrome or fear, and just taking action. Because you're absolutely right. If you can run an inpatient service, you can run a business. If you can get into medical school and graduate medical school, you can run a business. And so absolutely, that is awesome. Well, let's pivot a little bit and talk about community revitalization. And I know you're working on revitalizing downtown, working on some real estate as well. What does that look like for you?
Yeah. So it's fun right now. And I will tell you that I'm, again, so excited to be on the show. When I say that I have binged your podcast, and I literally, every episode that I finish, I'm like, okay, maybe I should buy 12 homes in 12 months, and maybe I should do this, maybe I should do that. And so it's so fun to listen. But what we have going on right now in our town, and really throughout Alabama and maybe throughout other parts of the country, is this push to revitalize our downtown. So there's this great program that's called Main Street Alabama, and it's come into rural communities throughout the state, or just communities in general throughout the state, really encouraging folks to build up their downtown areas. And so there are many people in the town that I live in now, all business people, otherwise I'm the only physician, who have decided, there's property that's out there that no one is doing anything with. Why not? Let's buy these things up and let's turn them into something that would be both beneficial to our community, but also profit driving, right? And so we have some great things going on here just in our community. They actually are putting a school for health sciences. So where students come in, almost like a boarding school. So they come in, do their 4 years, and they are ready to go out fully trained to be, CNAs, medical assistants, EKG techs, ultrasound techs, fresh out of high school. And so that's going to bring a huge number of students and their families, their parents visit on weekends to our community. And so there is a push amongst lots of business people in town to start buying up some things and really, again, revitalizing our downtown. And so there's a beautiful stretch of 6 buildings that were actually built in the 1860s. So very old buildings that are there, but they have good bones, is what I keep telling myself. And next Friday, hopefully, I will close on those 6 buildings and really get to work on turning them into something. And I'll tell you that the drive for doing that really has been running my private practice, right? I had this mindset that if I can run a successful medical practice, I can run pretty much anything. And you were just saying that that's kind of the key to entrepreneurship, what we all have in us as physicians. But the being able to budget and negotiate contracts, to manage staff, to realize, or evaluate return on investments. Those are all things that are so important to running a practice that I know are also going to be important with, having this investment in this real estate property. So I'm excited to close and then to get started on cleaning the space out and then really turning it into something awesome for our town.
That is awesome. What a cool way to give back to your community, not only in your practice and really just completely change the community, right? In like such a pinnacle way with the health of your community. And then also revitalizing downtown with these buildings. It is so cool to see how you're impacting the community in so many different ways. And you're providing jobs for the community and all these other things. It is just so cool. Do you have any ideas in terms of what the plan is for some of these buildings? Willing to share some of those ideas?
Absolutely. And so my dad, again, I mentioned earlier his wisdom, and I'm not taking his advice on this one just yet. But I shared my ideas with him, and he says, Brittney, clean those spaces up, rent them out. You don't have to be the one who owns the business in every one of those 6 buildings. But I have wonderful ideas. We need like a cute little soft serve yogurt place. We need an office building that has just a lobby out front, and then you've got 4 different office spaces that maybe an accountant or an architect or an interior designer can have a space in the back, right? So they can all pay rent towards that space. We need a cute little children's hands-on museum. That would be wonderful in one of them. We need a great pizza parlor or some type of restaurant. Again, I'm in rural Alabama. On Sundays, nothing is open in our town, okay? And so we need somewhere where people can go to brunch or lunch after church or whatever else they have going on. And then just even to create more retail space. And so those are my ideas. Now, of course, being me, I want to be the one to run all of those businesses, right? And so what my dad is cautioning me against is that I cannot run 7 different businesses at one time, that perhaps I get the space ready and rent them out. And that certainly is a possibility too, and something that I will absolutely consider, because again, there's a need. And if we can, or if I can turn these spaces into something that someone will want to come rent, then their rent then pays the mortgage, pays, for the cost that I put into building these places up. And down the road, maybe I can put something in it myself. And so lots of ideas right now, but we'll probably lean on maybe me doing something in 1 or 2 of them and really renting out the others and letting them work for themselves.
That is so cool. Yeah. Wow. Yeah. My mind is racing of all the different possibilities and ideas of what you could do there.
Bowling alley.
There you go. Yeah. Coffee shop, bowling alley. Yep. So many different things. Mm-hmm. Yeah. That is so cool. How far away is your practice from those properties?
Yeah. So my practice is 6 minutes from my house. So I can get to my clinic in 6 minutes. I'm going to do like everyone else and buy a golf cart and literally just drive my golf cart to work every day, because that's what most people in town do. And then those buildings. So my office is downtown. And so we're downtown right now. I walk past it every other day or so on my afternoon walk after clinic. And so it's, a half a mile away from my clinic space now.
That is cool. Wow. Well, I'm excited to hear how that goes and hear how that whole process works out for you. That is super exciting. So yeah, once you get those closed and you get those leased up or you start operating in those, let's get you back on and talk about how that process was as well. Because you've certainly dropped a lot of good knowledge about private practice, and I'm excited to hear how that journey goes for you as well. I've no doubt it's going to be incredibly successful for you.
Thank you so much. I'm so excited to get into that space.
Absolutely. My only ask is that I can get some free pizza, frozen yogurt.
Absolutely. Absolutely. All the pizza, all the frozen yogurt. Every time you come, we've got you.
Sounds good. That sounds awesome. Well, I just wanted to make sure as we wrap things up here, one, I wanted to make sure you're able to let folks know how they can reach out to you if they want to learn more. Please plug the podcast and so folks can give that a listen. And when they're ready to hang up their shingle, how they can reach out and work with you. And then the other thing is if there's any last closing pieces of advice that you want to share, feel free to do that as well.
Yeah, absolutely. Thank you so much. So I can be found lots of places. So I'm on social media, on Facebook and on Instagram, but my podcast is called Physicians Hanging a Shingle. And the whole idea of the podcast is to really pull back the curtain on the how-tos of how to start a private practice. I think that sometimes physicians still kind of gatekeep that process a little bit, but if we want more docs to find their joy, their fulfillment in medicine, I think that pendulum is going to have to swing back to more folks doing independent practice. And so, I release a new podcast episode every Monday and Thursday. On Mondays, the episodes really are all about the how-to. This is how you get referral sources. This is how you get patients in the door. This is what your new patient paperwork should look like. And the Thursday episodes then are all about mindset shifts. So it's really reworking some of those thoughts that we may be programmed or conditioned to make us think that we can't run our own private practices. So the podcast has been really fun to do. I love putting it out and have gotten really good feedback and response from it. So Physicians Hanging a Shingle, it's available on all podcast platforms. And then, of course, LinkedIn and Instagram, just at Hanging a Shingle for both of those. I've recently started doing some one-to-one coaching, which has been a lot of fun. I've spent so much, since I opened the practice, so much time really talking through with docs the process of starting their own private practice that I wanted to take it away from kind of a piecemeal thing to really developing a framework. So pulling together that system that I use, which again helped me to have a really successful launch and has made for a really successful practice so far. And it's a 10-session coaching experience and really just walks docs through, starting your LLC, getting everything set up for the practice initially to opening the doors. And so those things have been really fun to do. And so that's where you can find me.
That is awesome. We'll be sure to include links for all of that in the show notes. It is so helpful to have a mentor, to have someone that you can work with one-on-one to coach you, to help you open your own practice or buy your next deal. That can't be understated. And it's so important overstated. And it's, not only does that save time for you, right? You get open sooner, but also in this situation, you get open sooner, probably for way cheaper because you make less mistakes and you start with a lot more patients. And so it can be such a game changer. So definitely reach out, folks, to Dr. Anderson if you're getting ready to start your own practice. So that is awesome. Well, I know you have a trip coming up, and I want to thank you for your time and for coming on the podcast tonight. Thank you so much. Looking forward to hearing how these projects turn out for you.
Thank you. I love that. And if you will allow me, I want to take one moment. Alex, the first episode that I listened to, I stopped. I didn't even get through the full episode before I stopped and left your review saying how happy I was to have found your show. So thank you for what you were doing for docs, really to help us again, kind of push the boundaries a little bit and realize that we don't have to be confined to just practicing medicine or to just practice medicine in a certain setting. So thank you for that. And so we are recording on your birthday, if you don't mind me telling everyone that. So you all please give my friend a wonderful birthday gift and go leave him a positive review. I know that if you are anything like me, you have gotten so much from listening to this show. So do that for me, for him, for his birthday.
Thank you, Dr. Anderson. I did not tell her to say that. And that means so much.
He did not.
Awesome. Well, thank you so much. I really appreciate that. Thanks for listening to the podcast and for everything that you do. Looking forward to having you back on the podcast again here soon. We'll talk about that real estate adventure and go from there.
Sounds great.
Awesome.
Thanks so much.
With that, absolutely. Yeah. With that, it's been Dr. Brittney Anderson, Dr. Alex Schlow with another episode of the Physicians and Properties podcast. Signing off. Hey, real quick, if you're still listening to this, I'm assuming you got value from it. So I need your help specifically. My 2-year vision with this podcast is to help 100,000 physicians learn how investing in real estate can give you the freedom to practice medicine and live life how you want. There are 2 main ways that a podcast grows. One is through ratings and reviews, and the other is word of mouth. If you can please leave me a 5-star rating and review on Apple Podcasts and Spotify, as well as send this to 1 to 2 friends that you think would get value from it, we can reach the physicians that we want to reach. Thanks in advance, and talk to you on the next episode. Please note that the information shared on this podcast is for informational purposes only and should not be considered financial or medical advice. The views expressed on this podcast are those of the host and the guest and do not necessarily reflect the views of the Department of Defense or the United States Air Force.